Hi, welcome back to my YouTube channel, Eye to Eye Health and Hope. Today we're welcoming my amazing uncle, Dr. Farron. Thank you so much for joining me on this interview today.
My pleasure.
Okay, so I guess let's get right into it then.
Sure.
Okay. Can you tell us a bit about yourself and what you do for work?
I've been a psychologist for 4 decades.
Wow.
Since God was a little boy, as they say. I was an adjunct professor at Dowling College and in the doctoral program at Adelphi, which was the Derner Institute for Advanced Psychological Studies. Um, I've had a private practice. I was in schools for 30 something years as a chairperson of the Committee on Preschool Special Education and um, director. We had a special ed preschool program, kids with language delays, and I was the director of that for the school district. Um, that's what I've done professionally. I've been the co-president with my late wife for the American Liver Foundation of Long Island for 10 years. It was a small chapter when we started. It was hundreds when we left. We had fundraisers, we had guest speakers. It was important work because it had to do with liver transplants and general health and organ donations. So it was very, very soulfully satisfying. I used to be a musician. That's my non-professional place. I had a band. Um, we did just like for your people who are interested, we did the wedding for Billy Joel's drummer, Lynn
Wow.
DeVito, and Dee Snider, who was at the time, way before you folks were born, the lead singer of Twisted Sister. No, of Kiss. Kiss. So that's who I am. I'm in the process of writing a book.
Wow, your work sounds incredibly impactful, and especially with children with special needs and working in a band. So that's really impressive. Okay, shifting
But
gears a little bit. Can you share some of your experience in dealing with the organ transplant process?
sure. My late wife was diagnosed with a very rare disease called primary biliary cirrhosis. Nothing to do with alcohol, although when people hear the word cirrhosis, they think automatically. Cirrhosis is just a disease of the liver. Her liver's bile ducts were rejecting her liver.
Okay.
So that's when we became involved with organ transplantation because at the time, the only remedy, the only treatment was an organ transplant. They didn't know anything about this disease when it first started. And organ transplants were very rare in those days. So we got involved with anything to do with liver disease research. That's how we got involved with that. And then that led us to organ transplants as they became successful. They started in Philadelphia with a surgeon named Dr. Tom Starzl, who was known as the father of liver transplantation. And one of his chief surgeons who he trained, Dr. Charlie Miller, came to New York and started the first liver transplant program at Mount Sinai. And that's where Eileen, my late wife, had her liver transplant. She was one of the first. So it was exciting. It was groundbreaking. They knew very little about it. The immunosuppressant drugs were fairly new in terms of liver transplantation. So we got in on the ground floor of it. And our work with the Liver Foundation really put us in touch with physicians and nutritionists and dietitians and everybody, nurses and nurses' aides and secretaries. We knew everybody in the liver transplantation section at Mount Sinai. So that's how we started.
Wow, it sounds like you found incredible support in the medical community during a really difficult
It
time.
really did. It was interesting because as much as we were thankful that they were doing this, they were excited about doing it because it was a brand new chapter in liver research, in
Mhm.
liver disease treatment. So they were just chomping at the bit to find new treatments and read the research and have meetings and they just welcomed us. Part of it, Eileen was a very bright woman, and she knew as much about the disease you would think as the physicians because they spoke to her. I was like invisible when we would go for consultations. They knew that she got it.
Mhm.
She knew the medication, she knew what they did, she knew the side effects, she knew what was contraindicated. I mean, it was just amazing. So it was great for us and great for them. You
Mhm.
know,
So you kind of already might have answered my question, but Did you and Annalene find the experience really positive?
Positive, exciting, frustrating. Um, Frustrating
Mm,
because we didn't know what was going to happen. So it was really frightening. Is she going to get a liver? Is the transplant going to work?
hmm
All of those things. But encouraging and supportive because of the entire medical community that was there. Also because with our work with the Liver Foundation, we met a lot of other families going through the same thing. So
Yeah.
it was a shared experience. And when we were co-presidents, I ran support groups every month for the families because it's not just the person who has the chronic illness, it's the family who has the chronic illness.
hmm
Everybody's impacted, you know, impacted differently in different kinds of families, but impacted nonetheless, you know. So yeah, it was frightening and supportive and joyous, believe it or not.
Oh.
Um, we found that a good sense of humor got us through, and some of the humor was very dark.
Oh.
Uh, I think I shared with you once upon a time when she first got the diagnosis and they knew nothing about it. The only physician in the country who really knew liver disease was Dr. Fenton Schaffner, brilliant man. And we said to him, what does our future look like? And he said, well, it looks 3 to 5 years. That was it, 3 to 5 years. And we're driving home, and Eileen turns to me and says, we have appliances with longer warranties, which is a phenomenally, horribly funny thing to say. But the message there was, we're going to get through this.
hmm
We're going to find humor in the darkest clouds. We're going to find something. And it's amazing what that does. I do that with my patients. I tell them, the power of humor because there's something called brain plasticity. The brain learns it creates new neural pathways.
hmm
And a lot of it has to do with the language you use. And if the language is pessimistic, that's how you're going to function. But if you start to use an internal language that's optimistic and humorous and joyful and hopeful, you create brand new neural pathways. And it changes your behavior, it changes your thinking. And I would imagine there's no research on this, but I imagine it changes your health status.
I would agree with that. That makes sense.
Well,
It's
there is a body of research that talks about the emotional correlation between positive emotion and good health.
Mhm.
So this was it.
It's inspiring to hear how you like were able to manage these challenges together with through humor. So I think people need to incorporate that a little bit more into our lives now.
Absolutely. Absolutely.
Yeah. Were there any difficulties and complications in the process?
Difficulties with her research, I mean, with her surgery. Well, here's another, as I answer this, it's another piece of the progress that was made by the medical community. When Eileen was 4'9", we're talking petite, petite, all right? For those of you who know women's shoe sizes, she was a size 5 shoe.
Okay.
That's teeny weeny. And she was a petite zero.
Wow.
And thankfully, she was a fashion designer because when we would go shopping, she would buy a petite zero and still have to take it in. So the problem is when you're that small, you need a child's liver.
Okay.
And that creates a real psychological dilemma because on some level, you're waiting for a child to die. You're not hoping that a child dies, but you're waiting for the child to die. And there's a level of guilt that goes in with that, a tremendous level of conflict, internal moral conflict. But we were able to get a child's liver. Today, they do partial liver transplants.
Yeah. Yeah.
They
It's
weren't they weren't doing it back then. It's unheard of. So we watched it happen. Again, we watched the medical community make breakthroughs, try new things. It's amazing what the liver transplant process today is not like it was when she had it. So it was it was nice to watch that progress, you know.
that makes sense. Yeah. Yeah, I can understand that. The conflicts and the moral aspect of it must have been challenging too.
It was horrible. So awareness is so important in this in any medical issue. Awareness breeds familiarity, which breeds knowledge and acceptance. It's terrific.
Okay, so what is your opinion on the organ donation process?
Um, I think it's improved,
Mhm.
it's smoother, more hospitals are involved,
Mhm.
more medical teams are in place. More local communities understand the importance of donating an organ when somebody dies, and they see it as almost a moral imperative. My my person's life, my husband's life, my wife's life, my child's life can mean something even in death.
Mhm.
Didn't happen 20 years ago.
Mhm.
Now, so the question was about the progress of it. It's changed, and I think it's changed for the better. And awareness, now it's on your driver's license. Are you an organ donor?
Mhm. Yep.
Well, for you, it's always been that way because you're young, But for old fogies like me, it was never on a driver's license.
Mhm.
So this is terrific. So yes, there's been movement and growth and hope.
Yeah. I agree. Yeah. My dad, I don't know if you know, but my father is an organ donor and it's on the back of his license. So
Go.
there you go. During the process, did you have any concerns about organ rejection?
Well, absolutely. That was a huge fear because they didn't have a lot of autoimmune drugs. They didn't have, they just cyclosporin was, which is the medication at the time. Now there are several different anti-rejection meds, but at the time cyclosporin was the saving grace.
Okay.
But we didn't know how it would work. We didn't know if it would work long term. We didn't know what the side effects would be. We didn't know if it would create heart problems
Right.
or kidney problems. So there was a lot of, but any new frontier has its fear. Whether it's medical or whether it's the pioneers going across country in wagons, there's fear when you're breaking new territory.
Mhm.
So on some level, she was one of the pioneers, but we were lucky. We were really lucky. Cyclosporin never failed.
Okay.
Dosage had to be managed. You know, we
Mhm.
had to watch her blood pressure. We had to go for blood tests all the time, but it never failed us.
Okay, yeah. So you were very lucky in the process. I'm glad.
Without a doubt, we were very thankful that it worked as well as it did.
I'm glad. Um, okay. Well, you already explained the side effects of immunosuppressants. And there was only one that you said, right? Now there's multiple.
Now there are plenty. Well, not plenty. There are several.
Mm.
Cyclosporin is not the only one. I couldn't tell you what the newer ones are, but I know there are multiple now.
Okay, yeah, that's good. We see that the progress, there has been a lot of progress made, and it's evident through the anti-immunosuppressant medication. So,
Absolutely. Well, you know more about that than I do.
learning.
That's it. See, that's the progress.
Yeah.
That's the progress right there. I'm talking to the progress. I'm talking to someone who represents the progression of medical knowledge, which is
Mhm.
you and all of your colleagues in universities.
Yeah.
You know,
Yeah.
good, good for you.
Thank you. Okay.